Hey guys, welcome to the Mini Med School. I'm Dr. Dan. Today for our topic on obstructive sleep apnea, I am so excited to have our guests with us, Snorlax, Pikachu, and Ash Ketchum. Thank you so much for coming on the show.
Oh, so happy to be here. So we're talking about sleep apnea.
So tell me, how did you guys first get interested?
And don't laugh at me. So we're just talking about medicine.
Yeah. So how did you guys learn about sleep apnea?
Pikachu, Pika.
That's a great question. So sleep apnea is essentially when you have episodes where you stop breathing while you sleep. And there are many different kinds of sleep apnea, but the number one most common is obstructive sleep apnea.
Pikachu, Pika.
So some of the causes of obstructive sleep apnea are if you have craniofacial abnormalities such as in Down syndrome or Treacher-Collins. It can be seen in kids with tonsillar swelling, but by far is most commonly associated with an elevated BMI and a large neck circumference. So there are several good screening tools that we use, one of them being the Stop Bang questionnaire. The stop being subjective portions, like if you snore loudly, if you are tired throughout the day, if you've been observed to have stopped breathing, or if you're getting treated for high blood pressure, and some objective measures such as if you have an elevated BMI, if you're over 50, if you have increased neck circumference, and you get a point also if you are male. And if you are greater than 3, if your score is greater than 3, then you're higher risk for obstructive sleep apnea, and less than 3, then you're lower risk.
Pikachu, Pikachu, Pika.
So if you're meeting high pretest probability, then you'll do a sleep study or polysomnogram. Usually this is at a sleep center, but sometimes they can have you do these at home. And during this, they track various parameters such as how your muscles move, your oxygen, and your brain waves to kind of determine the stages of sleep that you're in. And they basically look to see how many episodes where you stop breathing, as well as what your oxygen does overnight. And based on these results, they're able to kind of categorize how well you're sleeping, and if sleep apnea is there, the degree of sleep apnea.
I get to sleep steady. Now what?
So based on your results from the sleep study, if you're found to have moderate to severe, or if you have mild but a high degree of low oxygenation, then you would benefit from what's called CPAP, or continuous positive air pressure. And this essentially helps open up your airway through providing constant positive pressure. There are several types of masks, as shown below, but the most common are the nasal pillow and the nasal masks. But I always say, whatever one is best for you.
Pikachu, Pika.
So if you're not tolerating CPAP, and sometimes the insurance companies will basically look to see if you are using the CPAP machine to see if you should still be using it. Some other therapies, dentists can provide what's called mandibular assist devices that also help to open the airway, and there are good data showing that those are helpful. Um, Having obesity along with obstructive sleep apnea actually is one of the indications for bariatric surgery or weight loss surgery. Well, you guys, we've talked about a lot of things.
Oh, excuse me. He's asleep. Sleep apnea. 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 Apnea.
Can you say Pika?
Mama.